Hello everyone, this is Miss Rubin coming to you from All Women That Are Phenomenal, and there's going to be no intro. Today I am calling on all women that are phenomenal. Today we are going to talk about feminine hygiene and some STDs. Alright, hello. Welcome to All Women That Are Phenomenal, and thank you for joining this segment. Like I said, we are going to talk about women hygiene, STDs, things that need to be talked about. Gentlemen, if you are watching this channel, you probably don't even want to watch this segment. I'm going to keep this like tactful as I can, because I know some ladies get kind of grossed out about some things that are said, and so I'm gonna try to keep it under the medical terms. So let's get started. And you shouldn't be shamed about any of this, but I understand some women are uncomfortable about this. And the reason I'm doing this is because last weekend it was this female, they was arguing at the park. The guy said, that's why I left your ass, because you had an odor out of this world. Yo, vagina stank. But he said the other word. Okay, but she's like, really? Like, she didn't know. And it's amazing that so many women don't know. So I wanted to come and put my what I know and what works for me, and so maybe it might help some of you. Okay, first we're gonna go into what trich is, and trich is something that you can carry and you might not know that you have it. Okay, trich is let's see. It is a common sexually transmitted disease that affects both women and men, although symptoms are more common in the woman. And how common is trich? Trich is the most common curable STD in young sexually active women, as estimated 7 to 4 million new cases occur each year in women and men. Okay, how do people get it? It's caused by single-celled protozoan parasite, trichomoniasis vaginosis. The vagina is the most common site of the infection in women, and the urethra, the urine canal, is the most common site of the infection in the men. The parasite is sexually transmitted through the penis to vagina, intercourse, or vulva to vulva. The genital area, the mouth to mouth. Okay. The genital area outside the vagina, contacted with an infected partner, meaning I guess if you have herpes or something on the mouth. Women can acquire this disease from infected men or women. Both men usually contract it only from infected women. Okay, what are the signs of this trich? Most men do not have signs, like usually the men do not. However, some women have signs or symptoms of infections, which include a fishy yellow-green vaginal discharge with a strong odor. The infection may cause discomfort during intercourse and urination, as well as irritation, itching of the female genital area. In rare cases, lower abdomen pain can occur. Symptoms usually appear in a woman within 5 to 28 days of exposure, but sometimes trich is is an invisible disease. Okay, trichias. My friend had it for a long time. And also, let's see, what is that other one? Okay, and I'm back. Bacterial vaginosis. Okay, it's the most common vagina infection. Okay, it's kind of like a yeast infection. Okay, what causes it is, let me tell you what you may experience first. Some women may experience an unpleasant fishy odor with a vaginal discharge. The discharge is usually thin and grayish white. The discharge is often more noticeable after sexual intercourse. So with that being said, you might think that's just like you having sex. I mean, you just get through having sex and that might be some sperm left over. Okay. What causes it? It seems to be a combination of multiple bacteria must be present together for the problem to develop. Bacteria, vaginosis, they say it could come from douching a lot. Let's see. Some say, let's see, smoking, okay, it's an overgrowth of normal bacterial in the vagina. In the past, the condition was called Gardnerella. I never heard of that before. After the bacteria that were thought to cause the condition. However, the newer name, Bacterial vaginosis. Okay, I heard of this one. Okay. And it grows. Now, what I was told that you can get this like from wet towels laying in your sink and you go back and you use it. You can get it like from sitting on the toilet, not cleaning your toilet properly. You can get it also from just laying there, you know, after sex and not getting up, cleaning up, getting up, washing yourself. You know how some women like to, I was that way before when I was younger, just laying there with sperm inside of you and not getting up and getting that, you know, wiping up or taking a shower, whichever one, and you leave sperm in you. That could cause a bacterial infection as well. Chlamydia is another one that you can walk around with and don't know that you have. Chlamydia is that's very common transmitted disease caused by bacteria as well. Even through symptoms are usually mild. It only gets serious when you done had this for a long time and you don't get this checked. Chlamydia also can cause discharge from the penis. This is from a man. Chlamydia is the most frequently reported bacteria sexually transmitted disease in the United States, and ever since most people with chlamydia are not aware of their infections and do not seek testing. Also, testing is not often done if patients are treated for their symptoms, and estimated 2.8 million infections occur annually in the U.S. Women are frequently reinfected if their sex partners are not treated. Okay, chlamydia, of course, chlamydia is a transmitted disease. You can get, let's see, that can be transmitted during vaginal, anal, oral sex. You can get that. Here's the symptoms. It's silent. Chlamydia is silent, okay? You can walk around with this and not even know. My cousin had that, and when she did know she had it, she had real bad pain on the side and everything like that. She couldn't even walk. It usually appears 1 to 3 weeks after exposure. In women, the bacteria initially affect the cervix and the urethra, urethra, urine canal. Women who have symptoms might have an abnormal vaginal discharge or burning sensational, but most of the time you do not. If the infection spreads from the cervix to the fallopian tube, it can, like, if you're pregnant, it can like mess with your child. So it is very important that you have your PAPs done and all that, and make sure that you ask to be tested for chlamydia, gonorrhea, all that good stuff. You also want to be very in tune with your body. You want to I made some notes. Okay. Number 1, you don't want to have too many sexual partners. This will help you to have a healthy vagina, to help you have a healthy smelling vagina at that. Okay. Try to use all white washcloths as well. Try not to switch up and use different feminine washes if possible. Don't douche all the time. It removes the your clean bacteria away, and it will be easy for you to catch a infection. When you get through having sex, get up, clean yourself up, then come back and cuddle. Because sometimes if you leave the sperm inside of you, it could cause you to have an infection or also an STD. Don't use scented bar soaps. Water is really good, but if you want to use anything, you can use, there's Best Bees, that natural peppermint soap in a bar form. I use this. I mean, you can use this. You can use any cleansing wash of your choice. And this is FDS, and I'm at 14 minutes. Okay, so there's gonna be a part 2 to this. Okay, so I will be right back.